All right, joining us now, he's a world-renowned doctor, chief scientific officer at one of our great partners, the wellness company, and the man who had so much right about the pandemic when our public health officials had it all wrong. He's also the author of one of my favorite books, co-author, Vaccines, Mythology, Ideology, and Reality. 3 important words that really do go along with vaccines these days. Make a great Christmas gift. Go check it out if you want to give someone a stocking stuffer. Joining us now, our good friend, Dr. Peter Mccullough. Doctor, good to have you on. Merry Christmas.
Merry Christmas.
All right. We've had a lot of waffling, even under the Kennedy HHS. Do we put a warning on the COVID vaccine? Do we not? The evidence becomes more strong every day, particularly for young people, that there was a cardiomyopathy problem here, a heart inflammation problem. Why has it been so hard for our regulators to give the warning the American people need?
I think there's a deep state within the FDA connected to the biopharmaceutical companies. They really don't want to see this concession of a black box warning, meaning the vaccines can lead to death, particularly fatal myocarditis. There was a leaked memo. So somebody ethical within the FDA leaked it out, clearly 10 out of 96 for sure, probably all 96. One of them purportedly is Ernesto Ramirez. I looked at his autopsy back in 2021 and I said it was fatal myocarditis. I think the FDA should do the right thing, show courage, put a black box warning on it so people can be fairly warned if they're going to take any more of these shots.
Yeah, absolutely. Dr. Mccullough, as I am riding the metro into the city, as I'm walking around, even here in our office, I hear people sniffling and snarfling all through their day, and it doesn't seem like the flu has hit us yet. Maybe it's just regular colds, but what do we need to watch out for? I know you're a huge proponent of gargling and nose sprays and things like that. What can we do to prepare ourselves other than avoiding the people who are doing the sniffling and the snarfling?
Nearly impossible to avoid. Across Europe, it's really a quad-demic of common cold, influenza, respiratory syncytial virus, and COVID-19. They're almost indistinguishable from one another as an adult syndrome. Everybody should be on twice-a-day nasal sprays and throat sprays. Wellness Company has immune defense. That's probably the best in class. Additionally, I think gargling twice a day. My favorite is Spry to do it, after you brush your teeth. But you shouldn't go a single day without using a nasal spray, at least twice a day, because the virus sets up shop in the nose for about a week before it drains to the throat and starts with a sore throat. So by the time you have a sore throat, it's too late. The best defense, as shown in multiple randomized trials, are nasal sprays, throat sprays, and gargles. Additionally, oral immune boosters. Wellness Company has natural immunity. And of course, to have an emergency medical kit, be ready when it strikes.
I want to talk about one of those because it's incredibly popular, and I think people are starting to realize that there is a science to protecting yourself against contagion. So tell us a little bit about the Contagion kit, because I think in this particular immediate environment of the next couple of months, that could be a very helpful tool.
For sure. The Black Contagion kit is really focused on influenza, acute COVID-19. And we know actually from data from the bird flu, the human cases of bird flu, all the human cases successfully treated were on day 1 with oseltamivir or Tamiflu. Tamiflu works provided you start on day 1. You start on day 5, it almost doesn't work at all. We know with acute COVID-19, we can start with ivermectin or hydroxychloroquine again on day 1. If there starts to be wheezing, coughing, then the budesonide in the kit comes into play. Of course, azithromycin, secondary antibiotic for bronchitis. People can bail themselves out of a problem with this kit and not end up in the emergency room or at urgent care.
Huge.
Dr. Mccullough, my dad is one of those folks who, for years, he's gotten the flu shot. He's never really had any serious repercussions from it. But he called me last week and he said, Amanda, you wore me down. All of this talk against getting the COVID vaccine and now the flu vaccine. Now I'm actually going to ask you your opinion. And I said, look, Dad, if you've taken it for this long, then, I support you, whatever you want to do. But I would lean in the direction of not getting it. Is the flu shot any good?
This year is going to be almost certainly completely useless. We have the H3N2 strain, a subclade K. It looks like it's completely off base in terms of anticipating this strain in terms of the flu shot. Personally, I took 40 flu shots over time because I had to be on staff at a medical hospital. What it does is it makes you more prone to the common cold and actually tends to backfire, as shown in a recent Cleveland Clinic study. So I am not advising the flu shot for any of my adult patients, and I don't take it myself.
Wow, that's important to hear that. That's important. So I want to talk about something that one of your colleagues, another guy who had a lot right about the COVID era of bad medicine, Dr. Harvey Risch was on the show yesterday, the new cancer czar for President Trump, and he said, listen, we're going to do an intensive study about ivermectin and hydroxychloroquine to see if their anti-inflammatory effects could have a role in treating cancer. That was a big headline for us, and something I hadn't heard before. I'd like to get your reaction to what he talked about.
Well, we're greatly enthusiastic. And the combination is ivermectin, mebendazole. It's a fixed-dose combination offered by the wellness company. On label, it's used for occult parasitic infections, but more and more case vignettes and studies are emerging about the anti-cancer effect of those two products together, so patients can use them. It's legal to do this off-label. Now, we carefully note the reasons why patients want to do this. They should check it out with their oncologist, make sure it's going to be okay with their conventional chemotherapy. But there is a study underway at Cedars-Sinai Hospital in LA, UCLA. They're going to be testing ivermectin. I think we should see the National Cancer Institute do a large-scale clinical trial of the combination of ivermectin and mebendazole to see if it reduces, cancer outcomes such as hospitalization and death, or conversely, prolonged cancer-free survival, particularly for the common cancers, breast, colon, prostate, bladder. I'd love to see it. America wants it. And they want to see us do more in cancer care, and the NCI at NIH is the group to do it.
It's very clear yesterday. He said it here. He's doing it. We're going to do the studies. That was a big moment here.
Dr. Mccullough, as you know on this show, we are often talking about the weaponization and the politicization, usually of government and the justice system, but that also happened during COVID with the medical community. We've had a lot of conversations with you about the distrust that the American people now have because they witnessed that firsthand. Do you feel like with this new administration, with new people heading up the FDA and HHS, do you feel like the American people are moving in a better direction now as finally starting to trust these people again?
Well, Trump and RFK and, of course, the new group have made strides, no doubt about it. I think they are working against a biomedical deep state. But remember, the medical establishment is connected to the federal government through Medicare, Medicaid, and National Institutes of Health funding. So there's the strings attached. They can make great strides to, restoring faith. I think all the medical boards should drop their COVID misinformation policies, restore the doctors. The Federal Trade Commission should do the same. That's going to do a lot to rebuild trust. We do have to see some capitulation on where our government agencies went wrong and what they're doing about it now to make things right.
Sir, we have been so lucky to have this partnership with a wellness company. We get great access to your expertise and others in your company. And then our customers, of course, get incredible discounts on all the great stuff you do. I want to thank you for all your support this year and wish you a Merry Christmas. But thank you so much.
Merry Christmas and Happy New Year.
Yeah, thank you, sir. All right, folks, here's one of the great truth tellers in the medicine world. We're so lucky to have him in our family of experts. All right, to our audience, making America healthy again starts at home. It starts with you and me, right? And the Wellness Company helps you do just that. From prescription medical kits and parasite cleanses to their Contagion kits. We just talked about those a few minutes ago. They're the gold standards, trusted by doctors you see on this network. Be ready for anything. Protect your family. And here's how you do it. You go to twc.health/justnews, and when you check out, use the promo code JustNews to get the next 10% off. That's a good deal. And the Wellness Company now has a new product too. It's called Drop for weight loss excellence. You can use promo code JustNews100 and you'll save, get a load of $100 on Drop for weight loss without shots. Go check it out today. All right, we'll be back in a second with more news right after these messages.